Well, thank you so much for that. I'm not used to such a formal introduction, but what have you said? Thanks to everyone for having me here today. Just want to share that I live and work out of North Vancouver, British Columbia, which is on the traditional and unceded territories of the Squamish and Tsleil-Waututh First Nations. I've been asked to come here today to discuss our EMR portfolio. However, I thought I'd take it a little bit further, share a little bit more about Telus Health, how we're working to improve the health and well-being of the communities that we serve. Take you on a brief journey in terms of sharing some insights into our EMR portfolio, our strategy, as well as discuss how we're at the tip of the iceberg when it comes to deploying artificial intelligence to be able to transform the way care is delivered. I want to acknowledge that I'm also here with my amazing Alberta account manager, Susie Rendawa. She is, as I refer to, as the Queen of Alberta. She's a great resource and been in the industry for a couple decades now, and pleased to be here alongside Susie. So Telus has been growing and diversifying as a global technology company with a long-standing history of evolving our business with a commitment to putting our communities as well as our customers first. We have been diversifying and growing in healthcare for well over 15 years. And I was able to join Telus in 2020 as part of the Input Health acquisition, where we brought a next-generation electronic medical record portfolio to market that put the patient in the center of their care. And we coined it the Collaborative Health Record. I'm pleased to share that that is now our next generation platform within the Telus Health business portfolio, and we look forward to laying the foundation for future innovation in healthcare with the Collaborative Health Record and beyond. I'm also very pleased to say that all the work that we have done to grow and diversify our healthcare portfolio has been powered by purpose. And as the most giving company in the world, we've been able to provide $1.7 billion in contributions and over 2.2 million hours of volunteer work since 2000. I also want to share that purpose is our true North Star at Telus Health as well as Telus. It doesn't only guide our strategy, but it also is the blueprint for how we engage with our customers and our communities. We are on a consolidated mission to truly build the most trusted well-being company in the world and contribute to building the healthiest communities and workplaces on the planet. While many organizations generally share their commitments to social good, one of the most reasons I'm truly most proud to be able to work for Telus is the fact that we put sheer resources and efforts into action. To do good in our communities rather than just talking about doing good. This is a focus that we bring to every single aspect of our business. And in building healthier communities, we've expanded our Connecting for Good programs to help over 3 million Canadians in need. We've been able to improve the quality and safety and sustainability of our food through our agricultural business by leveraging technology and innovation. We have committed to being able to be leveraging 100% of renewable energy by 2025. That's next year. And becoming carbon neutral by 2030. These are audacious goals that have sound impacts on the way that we live and work. And specific to today's talk, we've invested over $4 billion into healthcare, becoming Canada's largest health IT organization. As Canada's largest health IT organization, we are truly committed to revolutionizing healthcare. We're constantly working to improve the healthcare experience through optimizing the patient and provider connectivity and improving access to care for those that need it most. A little bit of a look at some of the impact, whereby we connect over 100,000 clinical and allied health professionals to our technology stack across the Canadian healthcare landscape, whereby we formulate over 610 million digital health transactions, support over 12.6 million individuals on our pension and benefits plans, generate over 6.3 million virtual interactions a year with our patients, and we cover over 75.1 million lives across 160 countries. These are all stats that I personally am exceptionally proud of and that we can all look towards bolstering in the future. I also want to share that the reason I got into healthcare was to improve access to care to those that need it most. And at Telus, we truly believe that everyone should have access to care, no matter where they live, no matter what their socioeconomic status is. And our Health for Good initiatives are core pillars that allow us to be able to deliver care to those that need it most. We have mobile health clinics, we have MyCare services delivering mental health care, and we have low-cost medical alert services that are all core pillars to improving access to care and resources to those that need it most. When we look for our mobile health clinics, we have about 27 communities that are supported through our mobile health business. We've consulted over 250,000 patient interactions. We've invested $13 million into these programs through 2026, and they're significantly impacting the lives of those that need it most. As you can see on the quote on the screen, it shares that every single time that someone's in one of those vans, they're in desperate need of help. And these are the types of things that we're very passionate about continuing our contribution to and working closely with your communities to be able to enable. This is an example of what it looks like for a mobile health clinic to be serving an individual. And we've also been able to deploy hybrid care models within these mobile clinics. This is a mobile health van in the, This is a mobile health van in the lower downtown east side of Vancouver. Our Kila Lalem mobile health clinic is a hybrid care model that delivers both primary health care as well as Indigenous cultural services to make sure that those that require the care are getting the care that they need where they are. Our free virtual mental health counseling has partnered with organizations supporting lower socioeconomic status individuals in delivering a virtual mental health service to those in their homes and or in community centers like the YMCA, Dress for Success Vancouver, or Mamas for Mamas. And our medical alert programs also provide low-cost alternatives to 24/7 emergency support services to adults in need. I'm also very proud of our Indigenous reconciliation commitments and our now 5th action plan and report, whereby our actual 5th annual plan includes AI as one of the founding pillars. Specific to our reconciliation commitment, I'm proud to say that we support 116 Indigenous communities to date through Pure Fiber. We support 3,500 Indigenous women in BC, Alberta, Ontario, and Quebec through our Mobility for Good program, providing them mobile devices because we understand that women at risk are in need to be connected to the community. 5% of all of our Telus Care activities go towards our reconciliation activities and support for Indigenous community organizations annually. We've also invested $6 million into our Indigenous business through our Pollinator Fund, whereby we look for innovative groups within the Indigenous space and fund their projects to be able to support the development of new technology and innovation in the healthcare system. We've also dispersed over $780,000 to Indigenous-led funds through our Communities Fund. Now, specific to the reason I came today was really to talk a little bit further on our EMR portfolio. And something that ties everything I just discussed together is the back end. It's the most valuable player, it's the EMR. Our MyCare services, our virtual care services, our healthcare services, our mobile clinic services, they're all powered by one consolidated health record system in the back end. It's a solution that allows them to meet patients where they are and allows it to adapt with the changing circumstances of the healthcare environment to be able to allow them to deliver the best care possible. It's also one of the reasons why Telus entered into the healthcare space, and that's because Darren Entwistle's father was given a mismatch allergy profile in the health record in his hospital stay. So this is near and dear to our hearts. And very pleased to say that since our inception as Telus Health in 2008, we've become a leading provider of electronic medical records. We now have 1 in 2 family physicians using a Telus EMR, and we have 1 in 3 clinicians across the entire landscape in Canada using a Telus EMR. In terms of our, oops, sorry guys, I'm clicking on my screen here, but I have to double click, so I apologize about that. In terms of our EMR strategy, we truly want to reimagine the form and function of the electronic medical record. We want to help enable the best personalized data-driven care to all people anywhere. And we want to start by making sure that we can secure our current EMR base, by making sure that we're supporting our valued clients on their current solutions, supporting cloud migration, supporting legislative enhancements, and continually improving the support experience across our EMR deployments. We also believe in a future where data can prevent serious illness, integrate care, and also save the healthcare system significant funds. So we're working very closely with our provincial partners as well as our major EMR deployments to be able to leverage next generation standards-based messaging tools to be able to liberate that data and able to bring that mission to life. And we also want to continue on one of our foundational elements as part of our DNA to continually evolve our product set. And we look to bring to market the most innovative solutions on what we refer to as the collaborative health record. We really get to do this because the collaborative health record is a modern tech stack. It's got meaningful patient engagement tools built in from the ground up. It has the opportunity to truly reduce administrative burden, and it has the opportunity to be AI-driven as well. When we look at how the collaborative health record is reimagining the EMR, I'd like to refer to it as a paradigm shift away from the typical EMR. The typical EMR is designed as a system of record. It takes what you did on paper, replicates it in the digital space. However, the collaborative health record is more of a system of engagement. It puts the patient in the center of care. It provides the tools for collaboration across the continuum of care. And it provides a true end-to-end, all-in-one solution for you to be able to deliver care no matter where. When deployed, we also look to automate as much as possible. So the opportunity for you to book an appointment, send a notification out to a patient, letting them know their appointment's coming up, for them to fill out information, have that information be readily available at the fingertips of their provider, have that information pre-populate the SOAP note, and also trigger any follow-up activities associated with that is a real paradigm that we have today. The opportunity to also deploy it in a truly virtual sense is also something that we're very proud of. So not only is it a truly web-based, nothing to download, nothing to install, you can have it available to you wherever you are in the community, but also the tools of virtual care built into the solution from the ground up and not tacked on as a third-party solution, adding vendor overload. And most importantly as well is a truly data-centric platform, something that gives you an opportunity to build out a rich, customizable data profile specific to the needs of your deployment, and that can flow from the patient into the health record across all aspects of the health record and be amalgamated on a per-patient basis or a population health basis, and then also be exposed to the healthcare system for them to be able to leverage. So when we look at the collaborative health record and the traditional EMR deployments that we see in our communities today, most EMRs started out with charting and billing solutions. But the collaborative health record gives you not only charting and billing, but it meets you where you are and pivots according to the adapting and changing circumstances of today's healthcare landscape, and it gives you a true end-to-end platform. So the opportunity for online booking, the opportunity for video visits, the opportunity for intake assessments and outcome measurements and business intelligence tools, all in one place. And further, it allows you to be able to adapt to all the changing circumstances that we're seeing in the healthcare ecosystem. It's paired with a mobile application for providers for them to be able to deliver care on the go, whether that's a community paramedic visiting someone in their home, whether it's a nurse at a nursing station taking a picture of someone's wound and having that upload seamlessly into the EMR. And it also comes with a mobile application for patients to be able to access care on their own. Whether it's someone going through a mental health crisis or someone that doesn't want to present into the care facility because they don't have transportation or they're locked in due to weather. These are tools that are fully integrated and connected to the system to allow improved access to happen by default. So in summary, the next generation of our EMR portfolio is truly modern. It's agile. It comes with two-week development development sprints, providing an opportunity for us to take the feedback from the community and build it into our application on an iterative basis. It's designed to be interoperable. It's standards-based. It provides an open application programming interface to be able to allow communities to build on top of the CHR and connect their tools and business processes to the collaborative health record rather than being a closed system. It gives the natively built and integrated patient engagement tools to the teams at their forefront of what they do. And it also is there to support care providers through their journey. I also want to say that when we deploy the collaborative health record in our EMR portfolio, it's not we're not your average tech company when it comes to doing so. We care, first and foremost. We're also empowered by our Telus digital health ecosystem. And we also have clinical and system leadership expertise across our team, truly wearing their hearts on their sleeves in terms of every deployment that we do. And this leads to a shared vision of improved healthcare experiences and health outcomes. It allows patients to play an active role in managing their health, and allows seamless flow of health information to happen through a modern digital tool set. And first and foremost, it also provides efficiency for care providers to deliver care, reducing burnout, improving the quality of care being delivered. Pleased to say that we've worked with world-leading health institutions across the entire continuum of care to deploy our EMR and health records portfolios. And we've also worked with leading Indigenous health teams across the continuum of care to be able to deploy our EMR portfolio, of which we're exceptionally proud of. And it's thanks to groups like this group today that have allowed us to be able to expand on that footprint. Finally, I also want to share specific to the EMR, high-quality data is very important. We all know that garbage in equals garbage out. And the opportunity for you to be able to mine your data is very important. It's not atypical for me to see someone spending 3 weeks on spreadsheets to be able to figure out how many appointments they did in 1 week, in 1 month. For us, it's 2 seconds and a refresh, and you have a dashboard available to you. So every single data field, table, and action is available to you in our collaborative health record, and we've got partnership with Google supporting our business intelligence tool set. We also have opportunities to expose this data in very meaningful ways, leveraging APIs and other standards-based methodologies to fuel the healthcare ecosystem and their data continuum. This is just a quote from one of our large physical medicine and orthopedic surgical sites that has transitioned to the CHR close to a decade ago. But they went from another leading EMR to the CHR and took a bet on us. But they were able to reduce wait times for the province for surgical procedures by 30% as a result of doing this. And in doing so as well, they also showed that it doesn't allow them to only improve their wait times. It allows them to run their business with maximum efficiency, and it also allowed them to include the patients in the care journey. And when you have an engaged patient, you have a much more positive outcome at your horizon. I now want to pivot a little bit and talk about artificial intelligence. And we all know that this is a very hot topic in today's day and age, and we're very interested and proud of the work that we're currently doing in AI, but we also want to recognize that it's just the tip of the iceberg. At Telus, we have built out a governing structure around how we are going to unlock the potential for artificial intelligence. And we want to do so in a very clinically meaningful way. We want to do it responsibly, and we want to enable the best personalized data-driven care to all. We've built a series of guiding principles, partners, dedicated teams, and we're actively working on multiple different plays in artificial intelligence to first and foremost drive efficiency in the utilization of medical records for providers, reduce burnout, as well as improve the healthcare delivery mechanisms for patients. In terms of our collaborative health record, we've innately built AI-powered workflows into the solution, starting with the inbox, where a lot of the work and administrative burden lies. We've been able to deploy smart automation tool sets, leveraging OCR, AI, and ML algorithms in there to be able to take static files, read them, and drive significant time savings into the mix. And this is really just the tip. We also drink our own Kool-Aid. So I'm going to share a little bit of a smart automation pilot that we've done with one of our teams at MyCare. For anyone that doesn't know MyCare, this is a large virtual care wing of our business, whereby their entire mission is to help improve access to care for Canadians that need it most, partner with governments and other organizations to be able to allow people that are unattached to be able to see a doctor and even attach them if they don't have one. The problem statement that they had was the fact that when triaging inbound faxes, lab results, any static documentation that comes into the inbox, this takes a lot of time. It takes about 32 seconds per file that comes into the inbox for these individuals. Now, if you have 125,000 files per year, that's quite a lot of time. So we deployed our AI solution that can scan the incoming faxes, identify which patients it's for, it can match patients, it can create patients, and it can also streamline other downstream effects as well. The proposed benefits were, how do we save some clinical operations time? In terms of our pilot results, what we did was we were able to run a production deployment over 3 weeks. We used 19 clinical operations folks to be able to focus on what they were doing in the inbox, and we deployed our smart automation tool set. We ran this across Alberta and British Columbia, and we were pleased to say that the feature worked for 90% of all the documentation in the inbox. And while it originally took 32 seconds to be able to process a document in the inbox, the results were astounding, whereby I took that 32 seconds and dropped it by 96% and was able to show a 1.2 second per document time frame. This is huge. We're not trying to replace the clinical operations team, but we're trying to take that time, that 96% of time, and allow them to take better care of the patients and allow them to take better care of the clinic and the providers. So how can we augment people's time to deliver more meaningful work in the clinic as opposed to processing documents? This showed a time savings of about 1.5 to 2 FTE with this feature set. I also want to share that AI scribes are a very hot topic in my discipline right now. It's one of the most readily available, meaningful ways for a clinician to be able to save time doing paperwork. So this is from a study led by Ontario MD with eHealth Centre of Excellence and a variety of other very valid partners as well. They looked at the family doctors and nurse practitioners and were able to identify that they're spending about 19 hours per week on administrative tasks, including 4 hours of clinical documentation. So they ran AI scribes in the office, and for those that don't know what an AI scribe is, basically what you do is turn your microphone on, you let the scribe listen to the conversation between the doctor and the patient. It consumes that conversation, documents in the format that you wish, and suggests next steps. And we've formally integrated this into our EMR portfolios. So really with one click you say push it to the EMR, and that saves the clinical documentation time. We see a lot of clinicians spending an extra 2 hours per night, buttoning up their clinical documentation. And the study over here showed that 70 to 80% less time was spent on paperwork by deploying AI scribes in practice. This is 3 to 4 hours less of clinical documentation per week for a provider. 83% of participants stipulated that they would use AI scribe in practice. 82% of participants said that they recommend AI scribes to their colleagues. 79% said that they were able to spend more time with their patients. So And also, we also saw 76% of patients say their cognitive overload was significantly decreased. So we're able to give providers a much more meaningful interaction with the patient. We're able to reduce their cognitive overload. We're going to be able to improve the care that they deliver. These are things that are a no-brainer for us to be able to support and deploy in our EMR portfolio. I also just want to share that this is the tip of the iceberg. When we deployed our smart automation tool set in production with a series of our clients, one of the larger sites came back to me and said, Mark, I've got 100% satisfaction from our first AI-enabled workflows in the CHR, and they cannot wait for what's about to come. And really, this is just the tip of the iceberg. From the deployment of smart automation, we have an opportunity to now move into Gen AI clinical document writing, workflow automation, referral triage, as well as a series of other opportunities that rely on predictive analytics, personalized care plans, and this is once again just the beginning. So I'm very bullish on what the future has to share, specific to artificial intelligence and the EMR landscape and digital health, and very proud to be part of an organization that is helping shepherd the way forward. So in summary, we're revolutionizing healthcare, we're improving access to care, we're improving the healthcare experience, and we're all doing this with purpose. And it's truly powered by purpose. And that's one of the best things that I get to say when I go to work and slave away at the desk. Understanding that what I'm doing is making a difference. So with that being said, I just want to thank you all for listening to me talk for the last half an hour. Happy to take any questions that you may have and work with you to be able to revolutionize the care that you deliver and improve the health and well-being of your communities. Thank you.